Good morning, everybody. Please take your seats. Good morning. My name is Antonia Marinova. I am Associate Vice President here for Programs at the Boston Foundation, and it's my pleasure to welcome you all this morning to our conversation about the child care financial assistance system here in Massachusetts. Our team at the Boston Foundation is delighted to co-host this gathering with the Massachusetts Taxpayers Foundation. It has been a privilege to collaborate with them on this terrific work. I see many friends and longtime partners in the audience, but for those of you who are new to the Boston Foundation, we put equity at the center of everything we do. We believe that closing the gap on the region's greatest disparities opens pathways to opportunity, to prosperity, and to equitable outcomes. In this work, we are right now focused on 4 interconnected areas: child well-being, economic opportunity, community leadership, and community wealth. And while this morning's forum is about the importance of a well-functioning system of financial assistance that works both for families and for providers, that work doesn't happen in isolation. It's deeply connected with our larger focus on what it takes to nurture strong beginnings to the lives of our youngest residents and what it takes to ensure that they and their families and their communities thrive in this city that they call home. Now, almost a year ago, in January 2023, the Massachusetts Taxpayers Foundation released the first report, the prequel to this one, if you will, that examined the child care financial assistance system, highlighted its shortcomings, recommended some ways to reform it so we can ensure that the historic investments we were seeing in early childhood actually do lead to better outcomes for children, families, and educators. And this morning we are proud to partner with the Mass Taxpayers Foundation again to release the follow-up report called Building Blocks. This new report reviews progress that the Commonwealth has made under the leadership of Commissioner Kershaw in reforming the system. It notes and celebrates important areas of successful reform. It highlights areas that still need further attention. And it provides some updated recommendations to consider so that we can continue to work to improve the growth and stability of the early education sector. A special thank you goes out to our MTF colleagues and to Victoria Bergeron, most of all, the author of the report, who did such a stellar job with the new analysis. Today's forum will begin with some framing remarks from Commissioner Kershaw, under whose leadership we have made so much progress on so many fronts in the early education and care sector. Thank you, Commissioner, for your dedicated leadership. After the Commissioner, Victoria will walk us through a presentation of the key findings and the new recommendations in the research. Please make sure to note any questions that come up for you during the research presentation, because she will stick around for the Q&A session with the audience after the panel conversation. As is our typical practice with our forums, we will follow up the research presentation with a panel discussion that brings together a number of partners that represent different stakeholders, but all of whom who interact with the financial assistance system or are impacted by it. My colleague, Danubia Camargo Silva, will moderate the panel and introduce the panelists at that time in more detail. And of course, we will make sure to have plenty of time for any questions that come up for you as that conversation unfolds. After the panel, Doug Howgate, the president of the Massachusetts Taxpayers Foundation, will close us out with some brief remarks. And before I finish this morning, I would just like to extend a very special thank you to our child well-being team and our events team here at the Boston Foundation who make it all happen. And most of all to our senior program officer, Danubia Camargo Silva, who has been the master conductor of this work and of our partnership with the Massachusetts Taxpayers Foundation from the beginning. Thank you, Danubia. With that, it's my pleasure to introduce and invite the Commissioner to the podium. Welcome.
Thank you so much, Antonia, and thank you so much to the Boston Foundation and Danubia and the Mass Taxpayers Foundation for your partnership and for having me here this morning. It is personally very meaningful for me to be here. Most of you know I've spent most of my career in weaving my way through state government, but very adjacent to the child care space. So starting at Department of Early Education and Care, time at Department of Children and Families, and then at Department of Transitional Assistance. And I will say in all of those positions, I saw some of the challenges that our families face trying to access childcare and break down barriers. And it was an incredibly meaningful honor to come back to EEC and have the opportunity to oversee some of these really, really critical reforms. I was with Stavern Miller, who is the commissioner for the Department of Children and Families, the other day at an event where we were celebrating the procurement and the new contracts, particularly those that are focused on our families, involve the Department of Children and Families. And she said to me, "You've been at this a really long time." So thank you so much for giving me the opportunity to be here and reflect a little bit. I want to spend a little bit of time talking about the what and celebrating all the what, but I also want to spend a little bit of time talking about the how. As I was reading through the report again last night, and thank you so much for the work, Victoria, and to the Mass Taxpayers and the Boston Foundation for being just incredible partners with us and thought leaders. And very early on, when I came back to the Department of Early Education and Care, I think one of the very first conversations I had with Danubia, and she was like, "We have this report coming out. It's going to be a little hard to hear." And I was like, "That's okay. We need to hear that, and that's how we're going to get better." And the only way we get better is to have research partners and thought leaders and philanthropic partners who support our work, and 930 callers who are holding us accountable and bringing us good solutions and better ideas about how we move things forward. So today's celebration is really about all of us being together on what needs to happen for kids and families and how we make the system and transform it to be what we really think it can be. And I'm really proud of the what part of what we have accomplished. And as I read through last night, I thought, these were some like really big rocks we had to push up some hills. So I want to celebrate, the new regulations that really put families and the user of the experience of families at the center of what we do, that reduce barriers, that took away unnecessary documentation, that used the data to tell us who families were that were using our system so that we could make rational, easy access. We really pushed our team to think about our job being about facilitating access to the benefits that families are eligible for and to change culture in that way. You're going to hear from Anne from CTI later today, and I was up there for a program visit, and she said based on the work that we had done, they changed the entire name of their team from like the Family Intake and Eligibility Team to the Family Access and Engagement Team, and I was like, yes. That is what we were going for, right? We're Anne's here, so she'll tell you a little bit about that. But I spent time at Nurtury, and I spent time at Ellis Early Learning, meeting with the entire teams that those agencies have dedicated to navigating our system and trying to get families in and to stay in. Along with Horizons for Homeless Families, special help for our homeless families trying to access the system and stay in. And it was really clear that we needed to make changes to the system that were going to allow those staff to spend time where they should be, engaging with families and working across the program and not managing unnecessary paperwork. And so I'm really, really proud of the work that we've done. We have a long way to go in terms of the family-friendly policies and implementing them and getting our IT systems in place, but our new regulations really reflect the values that the agency has about putting children and families at the center of what we do, and that'll be the guiding light as we continue down our work. But as all of you know, it's multiple levers. So policies that really put children and families at the center, reduce unnecessary burdens and documentation. IT systems, we've secured $12 million in IT support through the Capital Bond Bill and the Future Tech Act and the governor's leadership to make a brand new family portal and system that will be 3 years in the making, but we're also going to be coming for you, KinderWait, which is our terrible waiting list system that is not working for providers or families. So we have a long-term vision around creating that system that is flexible and modern and dignified. And that includes a lot of the work we've done to move away from a market-based look at what rates do and cost base our rates and other parts of our system, like C3, on understanding the actual cost of care. I think they just had a trivia event over at, on the 9:30 call talking about the cost of care. We just released an updated cost of care study. Big headline, costs have gone up. I'm also really proud of the reprocurement. 15 years. It took us a long time to get to being able to do a reprocurement, and I'm really proud of the work that we've done there. We put a stake in the ground. We unfortunately weren't able to have that be an expansion procurement. You see that in the report. But we were able to do some really important things about standards we want for staffing, administrative support that our programs and providers deserve, making sure transportation is funded separately so kids can get to and from programs and be able to access those services. So a lot of really important things to build on, including building flexibility to reopen the procurement each year, whether funds are available. And then obviously you've talked a little bit about enrollment incentives, and I think, we are up at about 65,000 right now for our caseload, from a low of 48. I think we were in the height of the pandemic. So serving more families than we ever have, and that was really based on enrollment, and really thinking about your first report, the MTS first report with the Boston Foundation, about making sure we were thinking about children at the center of our work and less about the funding at the center of our work. So really committed to making sure that we are spending every dollar we have for the families that are eligible to receive them. And we also reprocured our CCR and Rs. So setting standards around customer service and supporting new standards for our CCR and Rs, and making sure that we're working in partnership with them as we think about the future state of the system. So I am really happy about all of the what, but I just want to say a little bit about the how. Because when I got to the Department of Early Education and Care, I was like, where is the staff dedicated to families? And we really didn't have that capacity at the agency, and we have built an amazing team. I think Tyrese Nicholas was going to be here, but she's probably, she's on her way. Okay, so led by our Deputy Commissioner for Family Access and Engagement, we now have a multi-pronged team focused on the voice and experience of families. We just hired 5 new family regional access coordinators that are going to be working in partnership with all of our providers, our CCR and Rs, our community engagements, our municipalities, to really break down barriers to the system as much as possible. We have our first ever family engagement manager through our preschool development grant, and bringing the voice of families. We're about to create a new family leadership council at the agency for the first time to really bring in the voices and experience of families. And without the work of that team, the procurement wouldn't have been possible. The changes in our work wouldn't have been possible, from the cost work to the reprocurement, to new contracts, to the policy work that lays ahead. The other how I want to mention is the focus the agency has really taken on building a research team. So I'm sorry, Doug, but Ashley White, our first ever director of research, is here, and Amy Checkaway. And we have made a concerted effort to build both our family access capacity to focus on the voice and experience of families. And we have focused on making sure that we build our research and data capacity so that when we make decisions, like we're not going to document the missing second parent because most of our families are single parents, we're using data to drive the decision making about the policies that we're using in our system. We're understanding who our families are that are experiencing homelessness, what the experience are of our families involved with the Department of Children and Families, and driving policy changes based on the research and data that we know from our system and that we know from other places are driving innovation. So I want to recognize the research and data team because we stand on the shoulders of making good, strong decisions when we lean into the data and the information that we have about both the qualitative and the quantitative experience of those in our system. And you can't do a report on early education and care these days, research report, analysis, without landing on the workforce. So I want to say a couple things about the workforce and the future work ahead, and then turn it over to Victoria to get to the real headlines of the day. So obviously the biggest priority we have in addressing capacity and making sure that early childhood education can deliver on the promise both for children and for their families who are seeking economic mobility opportunities is making sure we're addressing our workforce challenges. And there are some amazing things happening across the Commonwealth. There are apprenticeship programs and incubators around family childcare, and we are working hard to build a supported pathway. And with the codification of C3 and the commitment of the only state in the country that has made those stabilization grants permanent, we are making headway on salary. And we have a long way to go in terms of making it a meaningful career pathway with a whole set of compensations that attract and retain a workforce that can see this as a career. We're working with our higher education community to make those opportunities more accessible and have that be a recruitment and retention in. And you didn't talk about it in your report, but our pilot that provided childcare financial assistance to staff working in early education and care programs was an enormous workforce initiative, and we're looking forward to sharing some findings of some recent research about that as well. So I've said since I got back to EEC that we have to continue to work on multiple levers. So we can't pick just one thing. Even though we know workforce is our number one crisis, we couldn't let families not also get the attention they needed in terms of facilitating greater access. We couldn't let our rates continue to erode be so far below market and way below the cost of actual care. So for us to be able to continue to work to address workforce issues, we also need to continue to pay attention to the other levers. So we have nearly 30,000 families on a waiting list for child care financial assistance now. Turns out when you make it easier to come into the system, they come. And so we have a lot of work to do across all the systems. And so I just want to make sure that we continue to pay attention to the multiple levers. We have to pay attention to the workforce. It is our primary driving limiter for getting childcare where it needs to be to support the economy and support our kids. But we also have to pay attention to the experience of our families who need help paying for childcare, and also to our providers' financial stability and business interests. And so I believe we have the ability to do multiple things. And we've demonstrated with the support of the legislature, the incredible support of the legislature and this governor, that we are able to continue to make progress. I think we're going to enter into a pretty difficult budget time, but I think that means we can continue to work to make progress across. So I just want to end by saying that I'm incredibly hopeful because of the work of our new task force. So as many of you are aware, almost a year ago, the governor, through executive order, created an interagency task force on child care and early education to bring a whole of government approach to childcare, recognizing its essential role in the economy, its essential role in leveling the playing field for young children before they enter school. She has brought together the entire sector of government to really bring the resources of the formal workforce system, of our economic development system, of our IT system, to think about how we strengthen the sector. And to hear the Secretary of Labor and Workforce Development and the Secretary of Economic Development talking about this being the most important investment we can make in our Commonwealth and in our future has been really transformative. So that work will continue for the next couple years. And I feel really hopeful that we're going to be able to think about how the resources across state government can be leveraged to support our sector, to support our educators, and to continue to center the experience of our families within the system. So I am so grateful for the partnership with MTF and our research partners, and none of any of this would have been possible without those of you who opened your doors to let us come and talk to your staff and be at your programs, for the 9:30 call, who stays together and keeps us accountable, for our philanthropic friends who support and leverage new opportunities for us. And so, I feel daunted when I look at the things we still have to accomplish and the things that I lose sleep over. But I also feel really proud and hopeful about the work that's gone in and the transformations we've been able to lay the foundation for over the last several years. And that's really so much due to the partner. We worked together for many years, and when you see a leader in exactly the right position, leading in exactly the right direction, I feel gratitude to work with you every day, Tyrese. And we are so fortunate to have her in service in state government, and she will continue to push for the experience of families within the early education and care system. So, Tyrese, you. Thank you all.
Okay. Hello, everybody. Can you hear me okay? Great. Okay. So my name is Victoria Bergeron. I am the Early Ed Policy Researcher at the Mass Taxpayers Foundation. Really excited to be talking to you all today. It's great to see a room of a lot of folks that I've talked to and those that I hope to talk to more in the future. So I'm here to tell you a little bit about our newest report, Building Blocks, Status of Childcare Reform in Massachusetts, and what comes next. Before I get into the details of the report, just a little bit about MTF, who we are. We are a nonpartisan, nonprofit, a policy research organization focused really around the mission of providing unbiased policy recommendations that help to support sustainable and equitable economic growth across our Commonwealth. And we have focused historically in a lot of areas around the state budget, transportation, healthcare. But the focus in the past few years for us that has grown the most, I think, is early education and care, because we recognize how important the sector is to the sustainability of our state economy and all our communities as well. So our report, we hope, will continue to build on past MTF research. Like the commissioner mentioned, this is a sequel to a report that was put out in early 2023. So we're hoping to continue the conversation, add to the conversation about where policymakers and researchers should focus their attention next when it comes to the child care financial assistance system. And the report asks three main questions. What progress has the state made on CCFA reform in the past almost 2 years now? And as the commissioner said, there's been a lot of work done. And then the second question, of course, that there is still more work to do. Not every recommendation that we put forward in 2023 has been completed fully, so we want to make sure to keep an eye on those things. And then finally, what comes next, which is where we are going to also turn our attention to workforce support moving forward. So before diving into the details of the recommendations, just want to provide a brief overview of the structure of CCFA and a little bit about the funding history. I think most people in this room have all this, in the back and on the back of their hand, or just know it by heart by now. But I've learned a lot since starting, so I just want to have a little bit here about that. CCFA has three main programs: an income-eligible program that serves lower-income families, and two programs that serve families who are engaged with the Department of Children and Families and the Department of Transitional Assistance. And historically, CCFA, we've seen actually some big increases in the past few years, especially since the pandemic, just following a general trend in increasing investment in early ed across the board in our state. And it's been really striking to see that since FY 2020, funding for the Department of Early Ed has more than doubled. And the only other area of the budget that we see this kind of growth and investment is housing. So I think we can really see just the importance that the state has placed in this area, and that's been able to really drive a lot of impressive change in the past few years. And now I will this is my favorite slide, but really just kind of gives you a big picture, bottom line about where we see this report fitting into the general conversation around CCFA and ongoing work. CCFA serves some of our state's most vulnerable children, but for a long time the program didn't really change much, and that created a lot of challenges for families, for providers, for administrators behind the scenes. And so we want to make sure as a research organization that as investments have increased in the program and across the system, we make sure to keep an eye that those investments are leveraged in the most effective way possible, and that we keep, access, equity, sustainability of the programs and systems in mind as we go through these changes. So I'll just give a brief overview of the challenges identified in the 2023 report and their corresponding recommendations. So MTF identified 6 what I'm calling pain points in 2023 in the CCFA system. The first were insufficient reimbursement rates for providers. The second, an outdated contract for contracted providers. The third, challenges facing CCR&Rs, or Child Care Resource and Referral Agencies. The fourth were some outdated and burdensome policies that limited families' ability to access the system easily. The fifth is less of a pain point and more of an opportunity that our last report called out to use C3 as a complement to CCFA to really increase provider participation in both systems. And the sixth is the lack of a clear defined enrollment goal for CCFA. So the recommendations to match those challenges, in the theme of building blocks, I organize them in 3 buckets: foundational recommendations, infrastructure, and building higher. So at the foundation, there was a great need for reimbursement rates to be brought closer to the cost of care and really base reimbursement rates on cost of care as opposed to market rates. Number 2, update the contracts for contracted providers and make sure that they were more reflective of current needs and were able to also change over time more easily. For infrastructure, we have greater investments and supports for CCR&Rs so that they can serve families. And 4, to redesign policies, get rid of some of those extra burdens placed on families. And then finally, for building higher, integrate further incentives into the C3 program to increase participation in CCFA and incorporate a specific enrollment benchmark into budget language. So I'm going to go through each of those 6 now. And happy to talk more later on. There's a lot in the report, so I'm going to try to give a good summary here. So cost of care. As you all know, really the fundamental issue for reimbursement rates historically was that the rates were not set with cost of care in mind and were below what the true cost of care is, which really places a burden on providers and families. So on that, EEC has done a lot of work in the past 2 years to incorporate the cost of care. They worked with the Center for Early Learning Funding Equity to put out a first cost model report. And as the commissioner said, we're now updating that for 2024, so that's amazing. But this chart just gives you an idea that in only 3 scenarios, the costs outweighed what providers were getting as reimbursement rates in FY 2023. And really just highlights that gap there. So in 2024, following the cost study, EC reformed the rate structure with the support of $65 million from the FY 2024 budget. And the main changes here, in addition to raising the rates to be at 81% of cost of care, there were consolidations made for the rate structure, so that grouped the western, central, and southeast region, or not regions, but rates together, so that they would have a rate that matched more closely the geographic spread of costs. They had very similar costs across regions, but the rates varied. So this lessened geographic inequities, which was a major recommendation in our last report, and also combined the Metro and Metro Boston rates as well. So you can see the jump from FY 2023 to FY 2024, definitely making impressive strides there. But of course, the cost estimates are still higher. This chart just shows for infant reimbursement rates, but still some more work to do there. Happily, overall, we have green check marks here. And of course, this is a little bit simplified, but of the recommendations that were made in 2023, they have been completed in the past 2 years. So to further integrate cost of care into the rate setting process, like I said, eliminate some of those, lessen some of those geographic inequities. And EEC also received federal approval to keep working on this and keep incorporating cost of care more fully, which is the next step, is just to continue this work, improve provider rates, and keep this work going. For the contract reprocurement, EEC happily was able to complete the first reprocurement of child care contracts since 2009, which was a very, very big accomplishment. And these new contracts have gone into effect just this past month on October 1st. So we're still going to be watching to see how everything plays out, but overall, 19,000 slots were awarded across the state, and EEC prioritized infant toddler seats, other high needs areas, and providers serving high needs populations. Overall, as the commissioner said, this was not an expansion of the system, but there were, greater quality provisions put in place as well, so that the system can grow from here stronger. And the new contracts also will allow the agency flexibility to continue to reassess moving forward. The blue chart on your left gives you an idea of kind of why couldn't we expand the system right now. And a big part of that has to be cost. The cost of a single contracted seat increased from about $8,000 to $17,000 from 2009 to now. And so more than doubling. And the funding for the procurement roughly doubled as well. But those two numbers just mean that the overall seat allocation remains roughly the same as it was before. And then the yellow chart on your right gives you a sense of just how many providers are ready to enter into a contract and serve children this way, and shows you the number of income-eligible seats providers requested by region versus the numbers that EEC was able to award. So the status check for the contracts, it's mostly ongoing, and really that has a lot to do with timing. The contracts have just begun, and we are going to be seeing, how providers are able to implement the new performance tracking and be able to continue serving their children. And really the next step is to plan for possible reallocation, reprocurement, opening again if additional funding becomes available. Okay, so on CCR&Rs, our child care resource and referral agencies, it's a very important section of the report, I think, because for many families, CCR&Rs are their first entry point into child care, into the child care system, and CCR&Rs wear a lot of hats. They do a lot of the back-end CCFA administration for children with vouchers. They coordinate between other state agencies and work with providers as well. So I'm really looking forward to hearing more from the panel, especially in this section, just about improvements that can be made to help CCR&Rs be able to serve families even better. And a lot of that, I think, has to do with the technology systems that they have at their disposal right now, and hopefully some, I know there's work being done to consolidate systems, streamline data sources, and make the system easier for administration so that more time can be spent on family engagement. Also, just a little note on how other system changes that are going on also impact the work of CCR&Rs. I think it's important to think about, how the procurement is affecting those agencies as well, with children who were previously on contracted seats being transitioned to vouchers, and also with some policy changes that will go effect for C3 that will likely increase CCFA participation for providers, but that is also will add to the workload for CCR&R. So just making sure that as all these pieces come together, many at the same time, that there really is a need for updated, interconnected, better technology systems so that things can move smoothly and that providers are able to enter the system, children are able to continue their care, and CCR&Rs can serve families. So ongoing work overall for the operations of CCR&Rs, like the Commissioner really highlighted, EEC has placed a significant focus on improving family experience, improving family engagement, and CCR&Rs are a big part of that. So we really wanted to highlight their importance to that structure in the report. So the next steps here really just to work on those technology improvements and make sure that CCR&Rs, families, providers are in conversation during the development of those new tools. So on the policies for families, this is an area that happily there's been a lot of work done, as the Commissioner mentioned, removing some burdensome policies, making proof of income a little bit easier for families to meet, just providing them more options for self-employed parents, for parents who work multiple jobs, for immigrant families, lessening the documentation load for single parents, and then really focusing on change of circumstance reporting, which is reporting that families have to do during their child's eligibility period, to really changes that are relevant to their child's eligibility rather than unnecessary added reporting that parents used to have to do. So these have all been completed, and the next step is really just to, again, a lot of this is maintaining communication with the field, with the families, with the folks that are doing the work to see how family experience has improved because of these changes, and as we work towards more improvements to the system. In the 2023 report, MTF discussed how C3 could be used to support providers and complement CCFA by really helping providers with their stability and growth, and incentivizing CCFA participation, as well as the collection of more data across the system as a whole, so we can understand better where we need to focus resources. And as recommended, C3 was codified through the state budget this past fiscal year process, and several provisions were also included to connect C3 to CCFA participation as well. Starting in FY 2026, providers who wish. The next step for C3 is to keep track of how these FY 2025 provisions will affect providers this coming year. And we really also want to make sure that as C3 is still a relatively new program, we're still learning a lot about it. Providers are still working through their grant use and things. We want to allow the program to evolve while still centering quality, equity, and how C3 can support the growth of the workforce as well. So the last recommendation in the 2023 report was that an enrollment goal for CCFA should be written into line item budget language to help with strategic resource use, intentional capacity building, and better planning for the program. We saw in the past budget process, there's been a lot of interest from policymakers, from the legislature, on increasing access to CCFA, increasing capacity. but the funding level has not been sufficient to do so, and we know that the capacity is currently frozen. So we believe that adding an enrollment goal will really help incentivize a strategic use of funding and for the program. So this is the only recommendation that has not been acted on from the 2023 report. So we will continue to recommend that an enrollment goal be put into language through the FY 2026 budget. So what comes next? First, we of course want to continue to follow up on our next steps from the bulk of this report, especially in the areas of CC&R systems and technology, family engagement and expanding access, and tracking the impacts of C3 in the contract procurement. I think it's really important that as researchers, we put recommendations out, we want to keep track of where they are, follow up, and make sure that work is still being done. And also, we want to look further. And like the commissioner said, it's really hard to look at anything early ed right now and not talk about workforce, not talk about our educators, our providers. So MTF really hopes to focus next on workforce in key areas of compensation and retention, the workforce pipeline, career advancement, and looking at the workforce through a lens of small business support, especially when we think about our family child care providers and our smaller centers, because we really can't have a high quality, accessible, affordable early ed system without a workforce that is supported, growing, and sustainable. So that's all for me. Thank you all so much, and I look forward to hearing from the panel.
All right, good morning, everyone. It's a pleasure to have each and everyone here this morning. So many friends, like Antonia had said, some people that I've met in the very early days of my career. It's a pleasure, to be serving alongside you, at least for me, the last 10 to 11 years. So thank you. We had an incredible research presentation by Victoria and on child care financial assistance. And when I first did this research alongside with Easter Bank Foundation, I didn't quite understand why we were doing this. And I wasn't quite bought in on the importance of it, but when I heard from Commissioner Kershaw when she started her career as an interim at first, and she said, I used that report and helped us a lot. And then you asked, like, Denby, why are you doing a second one, right? And isn't one enough? And we're already doing some work. But for me, it's one thing that I will always repeat. If you have any meetings with me, which most of you have, is bringing back that promise from Commissioner Tutwiler to, in order for us to transform the system, which I think we're all committed to, first we need to stabilize. We got C3. Heal to then transform. And I see these reports as a mean to heal, because we don't report back to our communities often enough. And sometimes things change, but the families and the communities we serve don't know about it, or even the educators, because they're so busy, unfortunately, surviving, because that's how our sector was built. And I think we have what's the word? I think we have the responsibility to break down the cycles that have been plaguing the child serving systems. And we all ask for systemic change. But one of the things we need to remember is that in order for the system is made out of people. And each one of us in this room are those people. So we all hold a piece of the solution. So don't be afraid to, I always say that if something is bothering you, it's because you are the person in charge of solving that. And inspire others to do so either, because you may not see it, but be curious for that solution. So, but first, I want to say I want to say thank you for being here in person and virtually. And I'm really excited to dive deeper with the panelists here this morning. Their bios were sent via email. And so please get your questions ready. At 11:15, we're going to start our Q&A. Although we are all learners and teachers, but let's assure that our questions are real questions and not statements. And there is no pressure to sound smart. Sometimes we want to sound smart when we ask the question, but today I give you permission to just be curious. So let's begin by getting to know our champions joining us here today. Each of you in this panel brings a unique perspective and expertise that is just enriches our collective approach to the work that we're doing. Day to day, your efforts may not directly overlap, but the lessons we learn from each other can inspire and towards collective impact. And it is through greater alignment and strategic collaboration that true transformation will become possible. So let's start with you, Anne. Please, to start, please introduce yourselves by sharing your role, the name of your organization, and how your passion for this work, whether sparked by a moment, an experience, or a vision for change, has helped shaped your journey to the role you hold today.
Thank you, Danubia, for telling me I don't have to sound smart. Super helpful early in the morning. So my name is Anne Searway. I am the Chief Planning and Development Officer at Community Teamwork. We are a community action agency, regional housing agency, and community development corporation. We served about 58,000 people in over 70 communities in Middlesex and Essex counties last year, including 1,400 kids every day in childcare. I have been very fortunate. I started my career as a family service worker in a Head Start program, and really got to see the transformative experience that those comprehensive services can provide for families. Not only the ones that are provided through the Head Start program, but also elsewhere in the community, but also experienced even at a community action agency where we are the ones who provide most of those services, how difficult it is for families to connect to them and how difficult it is for staff to make that happen. So have been really fortunate over the past several years to work on developing solutions to those problems for our staff, both human solutions of getting staff in the same room and talking to each other, but also the technological solutions of letting staff be able to look in a computer and see what's happening with the family. And so we've been really, really lucky to get to do that, and love the idea of telling other people how to do it and helping other people down that road.
Thank you. Alex?
Morning, everybody. My name is Alex Chu. I'm the Executive Director for Reach Out and Read in the Northeast region. Reach Out and Read is an organization, we partner with pediatricians and medical providers to support parents and families in early relational health and literacy in the pediatric well child visit. Across Reach Out and Read network, we serve 7 out of 10 kids in the Commonwealth every year. That's 250,000 kids with about 2,000 providers and distributing about 500,000 books every year to kids and families. Part of the work that we do is also connected to how do we think about systems and the access of children and family in getting those systems through the medical side of the house, and how do those systems connect to things that are happening in the early childhood space. And so when I think about the report and some of those pieces, part of the work for Reach Out and Read is how do we think about connecting the medical community and supporting those children and families through some of the challenges that we're going to hear and talk about today.
Thank you. Kelly?
Hi, I am Kelly Graceffa. I am the director at ABCD Childcare Choices of Boston, which is the CCR&R for the Boston and Metro Boston region. I do want to thank Danubia and the Boston Foundation for inviting us to participate in this very critical discussion. I want to thank EEC for their partnership and their investments in us recently so that we are able to support families in the way that we want to. I've been working at Childcare Choices of Boston for 25 years. The last 10 have been as director. I also happen to be the mother of a 20 and a 21-year-old. So for me, it's really been essentially half a lifetime committed to helping myself and others achieve, work-family balance. Before CCCB, I worked at a CCR&R in New Jersey. I worked for a Head Start program, ABCD is a community action program. I also, even in graduate school, my work focused on first-time parents who had to go back to work financially and how they chose childcare. A moment at CCCB that I would like to point to is that coincidentally, about 10 years ago, we stopped calling our staff voucher counselors and started calling them family services specialists.
Awesome. Thank you. Myra.
Good morning, everyone. Such an honor to be here. Always such a privilege to be in these spaces. I am Myra Rosado. I'm the Vice President of Business Development at Nurturing Early Education, a mission-driven nonprofit specifically dedicated to early childhood education. We still serve over 1,100 children, most in marginalized communities. We have 3 early learning centers and about 150 family child care small businesses in greater Boston and also the north of Boston as well. My passion for what I do really stems from, one, I was a young mother, right? So I came into this really not understanding how to navigate the system. How do I do all of this? How do I figure all of this out? And I actually went into a family child care program for my young daughter, and it was such a breath of fresh air. She helped me navigate everything. She helped me understand everything and really helped me understand how important early education was and is. At that time, I didn't understand that importance, and understanding that really helped me say, this is what I want to do from that perspective. And also the small business perspective, where I was able to see myself in the early educators through my mother. You know, I knew I could see the sacrifice that they put into building their business. And I said, I want to help families, but I also want to help the educators build their business. So that's why I do what I do.
Thank you. And Myra, how long have you been at Nurturing Early Education again?
For 13 years.
Oh, wow.
It is a privilege to be at a place for that long. It definitely has been a long journey. It's been a great journey. And overall, what I've been through in the journey at Nurturing is that right at the beginning, it was 3 staff where I was. We had an enrollment coordinator, we had a director, and we had a home visitor, right? And at this point now, we're at 25 FCC supportive supportive staff. And the reason why we've really built that out to this point is because we understood that they're not just babysitters, right? When I came into the field, that was a common term used. And we really had to reimagine and re-identify what they were. They're not just babysitters, they are educators. We had to help them understand and empower them and help them understand that they are educators, they're small business owners, but how do we as well support them in that area, right? So therefore we had to build out instructional coaches at Nurturing to help them with their small business. We connected to other agencies within the Boston area like United Way or English for New Bostonians to really amplify the business part of things. As far as early education and like child growth and development, those are building blocks. Those things are important to the program. However, they are also the directors, they are the business owners, they are the educators, they are the counselors to the families. So how do we implement things to help them succeed in those areas as well? So there's been such a big shift from when I started to now, a great shift with the great support from Laura. She said, you have a magic wand, how do you want to build your program? This is how we build it. We build it from the ground up and make sure that we support them in all areas, not just education.
Awesome. Thank you for sharing that. And to help us, you know, one of the things that I'm asking is that change in mindset and heart set. I love what Amy said in the beginning of the conversation, that, and also just now, is how sometimes we say something and it has that shift on language and vocabulary. And words are so powerful in the way we refer to everyone. So instead of babysitters, early childhood educator. If you ask them, they prefer to be referred to as educators because that's what they are. And there's been a lot of shifts, so thank you for bringing that up again. And one of the things that I want to bring us up is that in the report, it really talks about the role of technology improvements as a critical area for advancing CCFA reforms, particularly in streamlining case management systems. How can updated case management technology improve the experience for families, providers, and administrators? What challenges have historically hindered the adoption of more efficient systems, and how can these be addressed moving forward? In no any specific order, I think you all have a different perspective to offer, and please feel free to get started, whomever has would like to get started.
Well, I can start by saying currently the CCRNRs are using at least four different systems to do the job that we need to do. And I would say, well, some of those systems talk to each other. They don't talk to each other very well. They are certainly very outdated. They do all have their pluses as well as their minuses. We're really looking forward to maximizing the pluses, so we can find out what works, consolidating them, streamlining data management. It certainly is just going to improve our efficiency, reduce delays. We need to be able to communicate with families better. The newest system that was added does have the capability to send text messages. For years, we have had to rely on snail mail, and we had to figure out workarounds to be able to even email clients and providers. So it's certainly going to reduce delays. We're going to be able to communicate more effectively with parents and providers, hopefully in their first language. It can reduce the delays for families. It can reduce the administrative burden on us, so we can do what we want to do, which is spend more time with families, connecting them to resources and supporting them in getting the child care and the child care financial assistance that they need and keeping it. So outdated technology, we're really looking forward to that. Certainly funding is a hindrance. We know that. It's also going to be really important for strategic planning to make sure that these new systems also have the capability to change as policies change and evolve. Timing is important. As soon as we get new technology, it's outdated. So we need to be able to keep up to date with that.
And I know that, Alex, you've been doing for many, many months now some work around that. Can you tell us a little bit more about what that work is?
Yeah, so happy to jump in here. One of the things, and the shout out to Strategies folks here that are in the audience, one of the things that we have the privilege of partnering on is work through the early childhood agenda. And one of the work groups that we're helping to co-facilitate is the work group that is trying to connect the healthcare sector to the early education and care communities. One of the conversations that came up in that space was, how do we think about data and data systems that helps to unify what are traditionally seen as very siloed data and information sectors? And so what we got as part of that feedback was, when you as a family go and have your well child visit with your kiddo, you're telling your pediatrician or you're telling your nurse practitioner a whole list of information. And that experience is the same over and over again, depending on whether or not you go into the education community or whether or not you go into the care community. And if we think about it from the medical or education or early education space, yeah, we have to collect that information because that's part of the responsibility of the data collection, and that's part of our compliance issues. But if we're truly thinking about this parent and family-centered perspective, the opportunity for us to think big and to really vision board what this is how do we think about a space that crosses those sectors, that centers the family and the children first, so that when they go to these spaces that engage in community access to service, that there's a way where those providers, both on the medical side and the education side, have the information at their fingertips and have the ability to not have to ask folks again and again for that information, but can use the information and the data-driven perspectives to say, here's what we can do next. We know that you've taken an ASQ. Here's what the next step is. We know that you have a behavioral health challenge. Here's what the next step is. And we don't have to do those driving pieces to understand every single time for that parent and family. That's just exhausting. When we think about what some of the challenges are in this space, for the medical side, Oftentimes the barrier there is HIPAA. And similar on the education side is the FERPA challenges of just, you can't share this information. And we also know that that is a barrier that can be overcome if we think about it differently. So are there ways and are there mechanisms that we can think about centering this conversation in a different way, using that language piece that you're saying, let's assume that we can do it. What are the ways that we can tackle this instead of we can't do this because of HIPAA and FERPA and all of the other data sharing challenges that we know exist out there?
Thank you. But should we do a new pilot, or do we have something that is already working?
I feel like you just led me down to it. Okay. So similar issues, right? And so in community action, because we offer this wide swath of services and the same family gets multiple services. Our 1,400 kids in care, all of the little tiny ones are also in WIC. And many of those families are also getting fuel assistance. They're also accessing our resource center for all kinds of things they might need. And one of the challenges that we have always run into is, how do I know? If I'm talking to a family and they're telling me they're having challenges with food, sometimes they don't necessarily know what the program is they're getting because our systems are complicated and they are poorly named and they are terribly branded. And sometimes it is really difficult for a family to know that the name of this program that I'm in, I just know I get this card and it lets me go buy formula. And so to allow our staff to be able to really look and go, oh, you guys are in WIC, or you used to be in WIC and it looks like you're not anymore. How do we get you reset up to that? So we implemented 7 or 8 years ago, an integrated case management system that allows us to both, it can function as the database for programs that do not already have their own database. So as you're doing locally designed things, it lets us build in there what we need, but it also accepts feeds. So it accepts a feed from our childcare software, it accepts a feed from our fuel assistance software, from our WIC software, and it allows our staff then to look at one record and go, okay, I see what's going on here, and then let me connect people better. It does also have a referral component, so if I'm working with a family in our family access department and we do an initial pre-assessment and you say to me that you are behind on your rent, I can connect you to our resource center where you can get connected to the services that can help you pay your rent. And do it through, I do the thing in the database, somebody gets an email, they can pick it up and they can reach out to the family. So everything isn't just, when I was a case manager, people would leave my office with a pile of Post-it notes sometimes that were like, these are all the people you should call. And now I have a much easier way to get the person to call you and to try and make that an easier process. And certainly, so we get WIC data, so there's a HIPAA hurdle that has been overcome to some extent. And a lot of it comes down to, there's the financial challenge. This technology is not inexpensive. There is also a very real data owner being willing and comfortable to work with us challenge. So if it is say a state or federally funded program and that information is in that database, that is who has to give us access to that information. And so there's a whole contracting thing, but there's also a real trust thing. There's a real trust piece of the owner of that data knowing that we are going to keep it safe and we are going to use it appropriately. And it feels as though childcare should be a field where if we are trusted to care for the children, we should be trusted to care for the data. And so it seems like a place we should be able to make that work.
Thank you. Go ahead.
I just want to jump in to say that I think the CCR&Rs are really poised to take advantage of this type of system. The 6 CCR&Rs, we are all connected to larger parent agencies, 4 of which are community action agencies, and this model is one that we all hope to integrate and follow, and as Anne already said, childcare needs to be a piece of that, should be a piece of that. We want it to be part of that.
But interestingly enough, I'm glad you said this would be really helpful, but that's not all you do, correct? So one of the things that we talked about is that with the new procurement, a lot has changed for you guys. Can you tell us a little bit more about so CFA, C3, contract procurement, and what has the role for CCR&Rs been in this process as well, in addition to being super friendly with families?
Well, I absolutely definitely want to say that the more family-friendly policies have allowed families, the community, stakeholders to start to perceive us as what we are meant to be, which is support for the families. And we want to continue that. We have a long-standing history of community connections. We're connected to the families. We we have the infrastructure to continue to do this. And we're looking forward to additional support and enhancements that's going to help train our staff. Our billing and provider services staff has oftentimes filled a gap to help work with providers one-on-one directly to provide them with the technical assistance that they can't always find elsewhere, and to enhance that role and really grow it so that we're trained to be able to provide those additional supports to families and to providers in that human contact way. We are there to work with them, meet them where they're at.
But with all these changes, right, the CCFA, the changes with the C3, you have also been supporting the providers, not just the families. And so there's this new responsibility that have kind of taken away some of that attention that you've been giving to families to also share that same attention to providers. Do you feel that CCR&R should continue to also support the providers, or should there be a whole new entity, a one-stop shop for these functions?
No, of course, it needs to be the CCR&Rs. We've been doing it. This is what this transition that's going on, we've been doing this for years. We've just, under different circumstances. We adapt, we are able to do it, we want to do it, we continue to do it. And as I said, we meet the providers where they're at. Certainly, we want the right we need the capacity to do it. We need the right tools, which, of course, modern technology can only help. And we look forward to taking on that enhanced role, which is really all it is. This is what we know. This is what we've been doing for many years.
That's awesome. And just again, going back to the important role of relationship, and you've built that relationship and that awareness. So just if we're able to organize ourselves and be more coordinated and tap into technology, right? I think that Anne has a great example right here of something that already works. Unfortunately, in nonprofit, we are always piloting things. And we don't need to pilot. We can just figure out ways to scale what is already working, and we don't need to reinvent the wheel. We don't need, sometimes we just need to take credit for something, when sometimes the credit is just to stand the hand and support a great idea to become reality instead of having to take credit each and every time. And one of the things that I want to bring us to is this piece around the workforce, right? Recently in October, the Liebman Report was released from the Rappaport Institute for Greater Boston, and it highlights that investing in early education workforce through better wages, training, and certifications is essential for improving care quality, expanding access, and achieving better outcomes for children. The MTF report, Building Block findings, also show that a well-supported workforce is key to providing stable, high-quality care. How do you see the connection between workforce investment and quality improvement playing out in practice?
Well, as mentioned, we have family child care programs. We also have early learning centers. In our early learning centers, it is very important for us to have the staffing to be able to provide the appropriate quality to our children. One thing that we're actually looking at right now is that we see a big boom in family childcare because it is entrepreneurship. It is geared, a lot of millennials are coming into the field, they want to have their own business, they see it as something that's appealing to them. So it's really working, it's really booming. But then we are seeing a contrast in our early learning centers where in essence it is shift work, right? So we need to make it more appealing to them. How do we do that? Through rates. We do that through flexibility. We do that through a quality of life, right? People want to have a balanced quality of life. So how do we help our early learning centers to continue to be able to staff early learning center teachers? Because if we don't have them, we can't provide the level of quality we want to provide to our children. Something else we're seeing in our centers right now is that about 40% of our teachers are over the age of 55. We're going to have a lot of teachers leaving the field very soon. They are retiring. How do we build and sustain that pipeline to bring those new educators coming into the field that are very interested in and see it as a viable business, not just a business, but as a viable employment, that they can have a quality of life, they can have children, they can pay their bills without being stressed out. So there is a big investment we need to put into that workforce, not just at the end, but right in the beginning, right? How do we make them want to do this work and have a passion for it? So.
And it is important to point out the prioritization that EEC did for our early childhood educators. That investment, it's key that they do have the opportunity, and EEC did prioritize that so that families could get financial assistance, and even if they were up to 85% of the state median income. Of course, and unfortunately, funding is always going to be an issue, and so there definitely still, we need that continued investment, and the work, as Myra said, it needs to be prioritized.
And all of the pathways that are already being built. You know, there's pathways being built right now in the field. That is something that we should continue to support and continue to invest in, because when people are not sure what they want to do, they need guidance, right? So having all of those different pathways that they can come into the field is something that we should continue to focus on.
I'm gonna jump in to say that the quality conversation is interesting from the healthcare perspective as well. And when I say this, it's going back to the piece that I said a little bit earlier about thinking about this from the perspective of the kids and the families. What does quality mean for them when they're thinking about their children and they're thinking about their children accessing services? And so, you know, one of the things that I'm excited about that the commissioner mentioned was the interagency work group in thinking about how do we support across the different sectors. And so one of the things that comes up when we're talking about workforce is that healthcare offers pathways in this space as well, right? There are opportunities for engaging in parent learning. There's opportunities for next steps in careers. When we think about one of the pieces that came out in the MTF report that I found really interesting was predominantly women of color. And those are wildly underrepresented demographics in the healthcare space. And so when we think about how do we support folks that are entrepreneurs, how do we support folks that maybe are looking for a different opportunity but in parallel or aligned fields, healthcare desperately needs these folks right now. When we think about child life specialists, when we think about folks that are pediatricians, when we think about nurse practitioners, all of those spaces are wildly open right now as potential pathways. But oftentimes when we think about early childhood and care, we're thinking about the early childhood and care space, and there are sectors that desperately need these kinds of workers, of supports, of integration of those pieces. And folks that have the experience in the early education and care space coming into healthcare can make dramatic improvements for the life of children and families, because they bring a different and a specialized kind of quality when they have that kind of conversation.
And one of the things that is important to highlight too is that educators can't do this job alone, right? We need all these other sectors to coordinate and support to provide mental health, because a child is not just learning numbers. While learning numbers, they're learning how to manage their emotions. And there's just so much complexity to learning that, thank God to research and dedicated individuals, we're able to understand that we're not separating, that a child is so holistic and so complex that we need to have so much expertise while, you know, taking care of this child. But I know we want to add more, but I want to transition us very soon to our Q&A. So if you have a question, please feel free to raise your hand. We have microphones around the room, and we'll come to you. Did you want to add anything, Ann?
Wasn't those comprehensive services, that behavioral health stuff also affects the workforce. One of the things I think we don't say out loud enough is how hard it is to be an early childhood educator, and the number of children in these classrooms who have really significant behavioral health needs, and that the services are not available also for the staff. That teachers need additional training and expertise and mentorship in making that happen. And one of the things we have honestly spent our C3 funds on is standing up a behavioral health center to really be able to get our educators and our families, as well as our children, all of that support. Because that is also something that is draining the field, is how hard this work is.
Yes, because I want to make sure we talk about the fact that quality is a very elusive term. And it's not just the education of the provider, but to another parent, quality isn't that my teacher has a master's degree. It's that she's going to get down on the floor and play with my child and connect with my child, which connects to all of that, because we need healthy educators to be able to support healthy children.
100%. Thank you for bringing that up. And so we have a question, Titus, right there.
Thanks, everyone. I will ask the first not smart question. I'd noticed in the report from MTF the goal that was not addressed is setting an enrollment goal for CCFA. But I know it can be, so that is a great idea for the state because it would help us get, I guess, increase CCFA. But none of you directly have a control over CCFA. So I was wondering what you think is the value of setting a goal for enrollment. Forget about like the funding source, but enrollment in your program and in your community, your larger community. And have you set goals like that? Could you just talk a little bit about that?
So we certainly have enrollment goals as a provider part of it's just how you do your staffing. It's how many classrooms you can have open. It's how many staff you know you need to hire. Like that's really how the business is run, is knowing how many kids do we need to be able to serve. And also knowing that we are struggling to meet those goals in a lot of places, in large part because of the workforce issue. That we have classrooms that are not open because we do not have teachers for those classrooms. And it is a real like mathematical exercise to go, okay, we can get X number of children ready to come in, and that means we can hire 2 more teachers, but we can't pay those teachers if we don't have the rates that come from the kids. So it's a real puzzle to try and put it all together. But if you don't have an enrollment goal, there is really no way to potentially expand your program to its full potential.
I would add to that. I wear many hats, and one of the hats that I wear is overseeing enrollment at Nurtury. And we do have enrollment goals. We have budgets that we need to meet. And that is something that we are struggling with, right? Because we have FCC educators that one of the main reasons why they come to join the network in the system is for us to help them with enrollment, because they can't have a business if they don't have children. That's where the income comes from, right? So we do need to meet those enrollment goals. However, we also navigate understanding that right now there are caps in place. However, we try to figure out where can we get children from to make sure that our providers are enrolled according to their capacity. Right? So that's kind of how we figure out our enrollment goals according to the provider capacities. And then there are times that we may not be able to take on additional educators, because if we can't help them with enrollment, then, I mean, what else can we help them with? So it's a decision the provider has to make. Do I want to come with the system for the professional development support, for the small business support, but not really focus as much on enrollment? And he or she may have to get their own enrollment on their own. So there are goals that we set, but it really fluctuates depending on the current climate, the current ecosystem that we have to work with.
And enrollment goals connected to child care financial assistance can be a complicated mathematical equation, and trying to balance who is going to be eligible, who is going to get that child care financial assistance. We have a tendency to flood the system with at-risk children, and end up leaving a lot of working families on the waiting list. And I do not envy the person who needs to figure out that mathematical equation to make sure we can maximize the funding in a way that allows all types of families and children to access the system.
I'll take a little bit of a different take on this. Titus, to your question about why is it important, one of the things that we know about early childhood brain development is that we see the most growth in neural connections in children between the ages of 0 and 3. And when we think about the access and the opportunities, and we think about quality and workforce development, the folks that are here on this panel, my peers and colleagues here, they work with educators that are brilliantly effective at engaging children and call and response and back and forth. And so when I think about why is it important to set goals and why is it important to make sure that we spend down all the available funds to get there, is because access to those kinds of services, to making sure that children get the kinds of supports that they need, set them up for when we talk about a career and we talk about college and we talk about long-term capacity and access, all of that starts here. And setting those kinds of goals and making sure that families have access to those kinds of education opportunities is critically important for brain development for kiddos.
Thank you. And I have a question here in the front, the very first one here in the gray sweater, please. And then the pink.
This is potentially, can you hear me?
Yes.
In the weeds question, so forgive me, but you brought up the complicated mathematical equations that go into your budget. So I just wondered, one of the great areas of progress is in how reimbursement rates are set and tying that to the actual cost of care rather than market rates. But as people who think about these enrollment goals, like how does that factor in when you hear that reimbursement rates per child have increased? How does that factor into your planning in terms of big picture? Well, next year, does that mean we can serve more kids, and which kids, and things like that?
So I will say it doesn't usually translate to we can serve more kids because it's still a cost per child. And as you saw on the very fun graph, it's still red for almost every slot type. So it still isn't, it's still, nobody's making money in early childhood. Like it still doesn't put you over the edge. But it does affect what you can pay those staff. And it does affect, when we talk about flexibility, one of the things we've really, really been working on is 8 hours a day face-to-face with young children is too many. And so how do you work in planning time and time away to do other things? And so it does allow you to potentially increase some staffing. It allows you to increase what you're paying those staff. It might let you provide better health insurance, which is a critically important thing, or more sick time. Because of course with the classroom staff, you have to pay for a sub. So PTO and sick time costs money, like real actual dollars. And so that's stuff that those increased rates can do. Because it's dollar per kid, it's probably not more kids, but it may be better wraparound services and better things for your staff, which end up being better things for your kids.
And then the pink sweater right here. And then Laura, if time allows.
Thank you. Amy Shea from the Health Foundation of Central Massachusetts. Thank you for this great discussion. There's clearly a lot of great work that's happening at the state and local level in advancing this field. I'd love to hear your thoughts on potential challenges at the federal level in terms of federal funding and regulations. It may be too early to know the specifics, but for those of us that want to stay informed and think about how we can support the sector over the next several years, I'd love to hear your thoughts. Thank you.
So I actually made a mistake because we are at time, but if one person would like to answer that instead of the whole panel, that would be great. I love Q&A. I love to engage the audience. And then I forget that at TBF, we always end on time.
I'll take a shot at it.
Go for it.
Early childhood is nonpartisan in that we serve kids and families, and we serve all kids and families in the health, in early care, and for this sector, we stand on our values. And for those spaces that we can work in partnership because it is nonpartisan, we can move forward with that. And for those spaces that it conflicts with our values, then we stand up and we advocate on behalf of children and families for the best outcome and opportunity for children and families and our economy as a whole. I think for us specifically, it's a little too soon to know exactly what that is, but I think that the example that's been set by the Commissioner and by the Commonwealth has made clear what our values are in support to children and families, and we know where we'll be able to come to agreement, and we know where we'll be able to stand on our values. And that's what we'll have to start from.
Thank you, and thank you for accepting our invitation to be a panelist. And I would like to welcome Doug for our closing remarks. And if you can stay a little bit longer, that would be wonderful. And I apologize again for running a little bit over time, but I love engaging with each and every one of you.
So I am also committed to keeping us on time. My name's Doug Howgate, the president of the Mass Taxpayers Foundation, and first of all, what a fantastic panel. So just another round of applause for the panel, for Victoria's presentation, for the commissioner, and just a few very brief things. So MTF, as Victoria mentioned, got involved in early childhood education really 3 years ago. And really, I think the event today kind of exemplifies what our hope was and what I think we made a lot of progress in, right? There's such a great community in the public sector, advocacy community, the field, building kind of the prioritization of the importance of investment in early childhood education. What hopefully we can provide through Victoria's excellent work is some of the research, some of that connective tissue about how do we translate that into action, how do we see if it works, and how do we kind of make things better when resources are constrained, when we are facing a tight fiscal situation and things like that. So I thought today was excellent for that. I want to thank the Boston Foundation for hosting us today. I want to thank the Child Wellbeing group there for their continued leadership in this. I want to thank the events team from the Boston Foundation, Danubia, Antonia, everyone else. I want to thank the commissioner for being here and for her great remarks and leadership. I want to thank the panel, Anne, Alex, Kelly, and Myra for their perspective and also their leadership in the field. I thought that was a great discussion. And so, you know, there's going to be a lot going on over the next year. But I also just want to take a moment for folks to recognize all the progress that's been made over the last 2 years. Victoria mentioned a doubling in state-supported childcare. C3, the only state in the nation to do that. First time in 15 years of really taking a new look at many of the policies and procedures that affect families and providers every day. All of those things, I think, happen because of the conversations like we had today, hopefully a little bit because of our research as well. And so I want to thank everyone and have a wonderful rest of the morning.